I appreciate the comments, and I did not prepare a specific one, so I could, being last, I can respond to some of the comments that are made. I think refining well, let me first start with the story of my daughter's father-in-law. My daughter's father-in-law is uninsured, has a small business here in Provo that is not doing well, barely squeaks by, and he showed up at the emergency room at Utah Valley with chest pain in the middle of a heart attack. He was taken immediately to the cath lab where he underwent catheterization, was found to have blocked arteries, went immediately to surgery, had quadruple bypass, spent 2 days in the ICU, and went home. Received the same care that anyone would have. He was then very concerned, of course, about the bill that was to come, and because of his economic situation, qualified for a program where the hospital and the physicians provided the care for nothing, and his bill was just a couple of $100s. I think the question of access to health care for everyone in this country is not as much a question of access to health care, but as access to health care without the fear of economic ruin. That's what you were speaking of here. That's what keeps people from going, is because they're afraid that they will be ruined. And in fact, a large number of bankruptcies in the country and in the state of Utah result from medical care bills. So the question is really, are we able to provide access to medical care without fear of economic ruin? And we have to look at the various portions of the population that we deal with there. There are those who cannot afford any of their own and need subsidy, and those are the poor that we've spoken about that need to be helped by those of us who don't. And there are those who have the ability themselves to help provide for themselves. Well, let's just take a look. I think in order to understand where we are, we have to find out how we got here. And how we got here has been mentioned, is that we ended up with a system that was destined to fail. We have an insurance program system that was destined to only increase costs. And I don't know if I can get my slides to work here, and if not, we won't use them, but it would be really nice. I'm not a Mac person. Oh, this is a PC. Ah, come on. There we go. Okay. This is just a graph of total per capita health care, and you can see this is unsustainable. We cannot continue to do this. I think it'd be a rare person who says we can continue with the current system. But the way that we got here was with a system that decoupled personal responsibility from health care desires. Governor Leavitt has used the example of purchasing an automobile as the way that our healthcare non-system works. Well, if we look at the insurance and compare that to auto insurance, we can kind of see how the healthcare insurance also has led to this cost problem. If automobile insurance worked like health insurance, when you went to fill up your car, you would pay $10. When you go to the pharmacy now, you can get your drugs under a good health plan for $10. About a year or so ago, as you know, the gas prices went from $2 to $4. And so what happened? People drove less, they bought fuel-efficient cars, they modified their behavior because of that change in price. If car insurance worked like health insurance, you would still pay the $10. Would you care whether it went from 2 to 4? You would still have the same behavior, drive the same cars, go the same distance because you are insulated from the cost. And our current health insurance program has insulated people from the economic costs of their individual medical decisions. And the HSA is one way that helps open that up. I personally have an HSA. An HSA means that you are given money by your employer or perhaps by the government or such that you have control of, and you're paying the initial dollars. And so when you go see your doctor and your doctor says you need a CAT scan, nowadays under your insurance you say, well, schedule it. If you're paying with money you have control over, you'd say, where's the cheapest place? And now you have people competing for your business on price like everywhere else. The other thing that happens with an HSA, just as an aside, is under the current program, if you have insurance and you have a $20 deductible, you go to your doctor and you pay $20, how much health care do you expect to get? $20 worth. Well, the doctor sends in a bill for $125 to the insurance company. You never see that. Now, if you have to pay the $125 on the HSA, you darn well better get $125 worth of care. It improves quality also. Some of these things that work, but there are certain things that everyone agrees on. Everybody, I would hope, agrees on accessibility. Healthcare, insurance, healthcare itself needs to be accessible. The idea that one can be excluded for pre-existing conditions is unconscionable. that should be removed. The fact that someone cannot get affordable health insurance, whether with their own, through their employer, on their own, or subsidized by the government if they don't have their own income, is not a defensible position. All must have accessibility to protection from economic disaster of obtaining health care. The other things that people agree on is portability. People shouldn't be locked into their jobs because of their health insurance. They should be able to take it from one job to another. Governor Leavitt talked about transparency. Transparency of cost. Cost is hidden so deep in our system that it's almost impossible to tell what things are going to do. And I'm going to go to another slide here, and this is really bad news for Governor Leavitt, because this is my wife's colonoscopy bill. And she had it done here in Utah County, and her total bill was $850. It was a good colonoscopy, too. My partner did that. But I don't know if you can see this well up there, but this demonstrates a number of things. If you'll notice that the initial bill is $1,100 plus $600, $1,800. That bill is what you would pay if you walked in off the street and just wrote a check. It then undergoes a decrease because she has insurance of about half. So her bill that we have to pay is half simply because she has insurance. That's not fair. That's not equitable. It's not transparent. This also, though, while I've got it up, provides one other little point of interest, and that is one of the things that Americans expect in whatever healthcare system comes up is the same level of healthcare they're currently receiving. In some ways, we are spoiled. And this is an example. If you look at this bill, you'll notice that at least half of the cost of that bill is the surgical center. The reason it was done as a surgical center is because my wife, like the rest of us, is a little wimpy and wants to be asleep during colonoscopy. I assume you were asleep during your colonoscopy. That was half the cost of the bill. If you go to Germany, 90% of the people are not put to sleep because the German health system looked at that and it says, do we really want to pay $1,000 for 10 minutes of less abdominal cramping? Says, no, you can have a little abdominal cramping for $1,000. So 90% of the people in Germany do not get sedated for the colonoscopy. But their cost is half as much. So in order to decrease, one of the problems with decreasing costs is people have to expect to have a level of care that is different than what they're currently receiving. Then there's affordability. We all agree on affordability and tort reform. And I will say that the legislature has made some major efforts in tort reform, and if there's questions about that, we'll deal with that later because I'm running out of time. Let me just tell you what's happening here in Utah. Let me go to this slide. This is an interesting slide. This slide looks at the different states in terms of how much they spend for health care and the quality of the health care. You would expect that the more a state spends for health care per capita, the better the quality. And in fact, as you can see, it's a scattergram. It's all over the place. But up in that upper right-hand corner with best quality and lowest cost is Utah. We have a great state for health care. Some of that's because of our lifestyles, because of who we are, and some of it is because of our health delivery systems. But let me tell you a little bit about what's happening in Utah to help with health care costs. The legislature is setting up an insurance portal to help with transparency. It's like Expedia, where the different insurance companies would put on there what their costs are, what their benefits are. It's out in the open, it's transparent, and you can make appropriate decisions. We're also working with concepts called medical home. It's clear that management of chronic disease is an important portion of decreasing healthcare costs. And the medical home is a return to the primary care physicians who are physicians or nurse practitioners or physician assistants who are in charge of making sure you go see the right person, that you don't get too much or too little care. Electronic medical records, Utah is a leader in electronic medical records throughout the state. We have an organization called UVU. My medical records are available at the hospital medical records are available to us, and it greatly improves reduced duplication and the efficiency of medical care. Intermountain Health and other agencies here have developed evidence-based protocols that have helped in various diseases such as diabetes and pneumonia and have decreased costs. We're developing wellness programs for employees so that they're more engaged in their own health care. Safeway, for instance, has a wellness program for their employees where if you go to their cafeteria, you pay full price for a hamburger and you get a free salad. And it actually has helped improve theirs. We work towards transparency of costs. Our clinic is putting its fees up on the internet so everyone can see it. transparency of outcomes. One of the good things that has come of this whole healthcare debate is that the private sector has been forced to start looking at methods of changing cost. If we simply look at accessibility and don't look at cost, the cost is overwhelming. The demand for free medical care is unlimited. So there's several other things we're going to do. I think I'm just about out of time. I'll wait to see if there's any questions. But I think that a combination of, I'm in Governor Leavitt's camp, that the government's structuring a system that allows accessibility, affordability, transparency, accountability for outcome and costs is one that makes use of the strengths of the American economy that's worked in all other areas of our government, of our country. Thank you.
The remarks that they have prepared, and now this is the part that I'm most excited for, is for the next 10 minutes, hopefully members of the panel, I don't know if you can hear me, if you guys have questions for each other that you would possibly like to discuss, let's do that.
I bet they do.
And let's keep remarks to about a minute, and then after that, we have the remainder 20 minutes for student questions. I've collected a huge list, actually, and we'll try to work through those as quickly as possible, but let's begin. Does anybody have any questions they'd like to ask each other?
I might just go ahead and start with one, and this might go to Dr. Minch. And Dr. Minch, you had mentioned earlier about all of the other, and I think even Dr. Engelhardt had said it too, that there's all these other systems, highways, security, things of that nature that we collectively provide on a moral basis, and that I do agree with. There's definitely an economic principle known as a market failure, where free markets just simply will not take care of some of these things. That's why we have tax revenues, tax receipts, and I get all of that, and I can hop on board with some of those things. I guess the question I have is we're trying to imply a moral imperative on something where if we've never really tried a free market system, we've really never tried to regulate this system through the mechanism of choice. To me, it seems almost immoral to try and legislate this, to try and strip that choice, that fundamental liberty away from people. On the other side of the spectrum, I definitely believe that it's immoral to deny that and to have a system that prevents that access. I think what I'm advocating for is a middle ground, but if you would maybe comment a little more on where this overall moral hazard is coming from in stripping that choice and that liberty away from people.
Well, I don't know of anyone who argues for a healthcare system, a solution to our problem that strips in terms of my knowledge, I don't know of any proposal that somehow strips all the choice that has to be made in healthcare decisions away from patients and families. I certainly wouldn't advocate such a system. I think that people ought to be able to, in consultation with their doctors, and come up with the best health care plans and the best health care that suits their needs, just as you said. And I really don't know anyone who disagrees, so I'm not sure if I understand your question. I think you said earlier that you thought that there was a far-left proposal where the government would be in charge of everything and make all the decisions and so on. And, I don't know who's advocating for that, really. It's certainly not on the table for discussion in the United States. Both the Senate bill and the House bill that are being, they'll get reconciled and they'll go to President Obama. But neither one of those bills, they're both entirely market-driven. I mean, even the single payer, just the system of the single payer element of it is off the table. So, Frontline did a very, very nice documentary a couple years ago comparing the healthcare systems of Japan, the United States, Canada, England, France, and a couple other places. And you can still look at that. You can go to the internet and go to PBS and find it and watch it. And Germany was in there. And then compared systems that were single payer systems and systems that were market oriented and those that were a hybrid. And I I think the United States will have a hybrid system, just as Governor Leavitt is calling for, and others are. And the only question will be, you know, how powerful the market will be in that system. But there's no option on the table that diminishes the market very, you know, radically. So.
I'll comment on this, and I do have the advantage of having run this system, and so I acknowledge that as an advantage here. If you control the payment and the reimbursement, you control the system. I'll cite a couple of examples. Mention was made of the government negotiating the prices of drugs. Now, I know how that happens. I know how it works. I've done a bit of it, and here's the way it works. You have to say to the drug company, unless you're willing to reduce your cost, you will not be offered on our formulary. So, in other words, today what you do is you give up consumer opportunities to have a drug, and that's what happens in socialized systems all over the world. And I've studied healthcare systems all over the world. I've studied the Switzerland system, and the English system, and the French system, and the German system. And anytime you get into a socialized system, you find things that are really quite admirable. I've come to really value the way they deliver primary care. However, if you get above primary care, your friend Matt and what is it? When they get to be 75. If they want to have a hip operation, no deal, because the government's decided we don't do that for people who are 75 years of age or older. And to their credit, what they have done in socialized systems is that they have done two things. The first is they have created what they call a global budget. This is as much as we're going to spend. That's it. And we'll provide as much health care as we can for that. And the way they ration it is in two ways. They will limit the formulary so that you can't get the brand name drugs, and the other is they have a line. They say, yes, you can. Everybody has access to a hip operation, but you'll have to wait 7 or 8 or 10 months. So then you have to begin to ask the question, what is the ethics of that? And once you begin to deal with those ethical questions, then you, I think, do have to get back to the question of what is a happy life? Is a happy life unlimited health care, or is a happy life a pursuit of a job? Because the bottom line is, if you don't have people working, they can't pay taxes, and if they're not paying taxes, they can't have Medicare, and if they can't have Medicare, they're not going to have a health care system. If we get to the point that the system begins to crater, and people lose jobs to the Chinese and to the Indians and to the Vietnamese and to the others, then nobody gets health care.
Thank you. Is there any other questions the panel may have? With that, then, we'll move into student questions. The first one I find very important, I must say personally, because I am a pre-medical student. And I'd hopefully like to give this one to the panel, but more specifically to Governor Leavitt as well as Dr. Craner as possible solutions they have. As a student going into medical school, I worry about my health reform will affect my future. How will the current health reform affect future doctors? And the question, follow-up question on that as well is we are currently experiencing a shortage of physicians. And with less incentives for physicians, or without incentives, how can we fill that void, especially since there's going to be more healthcare needed, more demand for healthcare? So.
It is true. Actually, it's estimated that by the year 2020 that there'll be 200,000 physicians short in this country, and a lot of those in primary care. So as a person entering the medical field, there will always be work. There'll always be work. You know, and then the question comes up on what type of system are you going to work? And if there's a lot of criticism right now about the current system, which is the more you work, the more you make, which I happen to think is kind of the American way, but it does. If it doesn't have some brakes on, it can go on. But I think that as a future physician, there will be systems that you'll be working with, and you'll be able to use your stuff. Most of the care, though, for these missing 200,000 physicians are going to be delivered by mid-levels. Nurse practitioners, physician's assistants are going to play larger and larger roles. And medicine, which has been traditionally kind of delivered at the highest possible level, will now be started at the lowest possible level. And there's arguments in favor and against both of those. I don't know, Governor Leavitt?
I would just agree that we're moving into what I call the era of care extenders. And there's lots of different ways. I mean, the fact that we're seeing primary care clinics in drugstores, that's a care extender. The fact that nurses are doing more than they did in the past, that's a care extender. The reality is we won't be able to count on having a physician do everything. I mean, we've talked a little bit about colonoscopies. There are many countries where one physician supervises 7 or 8 or 10 well-trained nurses who are providing them and doing a darn good job of it, and the physician's there if there's a problem. And they get the colonoscopy cost down into what would be the equivalent of $300. Well, that's uncomfortable. I guess it's uncomfortable to talk about colonoscopies generally, but and here, let me just say, I'll be a little controversial here. Much of this is driven by professional societies within medicine who have skillfully drawn lines around their areas of practice and persuaded those who are driving reimbursements, again, if you control reimbursements, you control the system, that only they can do certain things safely. And they have a medical argument for that, but really what they're saying is, we don't want anybody else invading our territory because we like getting paid at the highest level of reimbursement. Many of the medical societies take on a bit of a union mentality. Now, they do very many good things, and they're my friends, and I tell them that directly to their face, but that's part of the problem, too.
Yeah, well, I cannot disagree with that.
I think a couple of things about this. First of all, I congratulate you and those of you who are going into medicine. Remember to study very, very hard, and once you get into med school, you will be studying very, very hard, and once you get into your internship and residency, you'll be working very, very hard. Now, what is your goal? Is your goal to make a lot of money? Is your goal to take care of people who have health care problems? Maybe it's going to be all the above. I think the issue at our forum here today is that people need access to a good health care system, that everyone needs access to it. And I think once you find yourself trained in this field, you'll want to make sure it happens too. I was surprised the other day with my top flight health insurance that I had to have a biopsy on my thyroid, and it was done by a nurse practitioner, not a physician. That's 6 needles sticking into a little place in my neck. Everything's just fine, by the way. But we are moving down that provider level. They decided they didn't need to have a physician in there doing that procedure, and everything worked out fine. But I think when we start worrying about a system that might be what's known as libertarian, where we start saying government is just too big and we need to get rid of all of these areas and just let us make our own decisions, we're really in trouble in this great country. This country is already providing a lot of benefits, and I believe one of those needs to be quality health care.
I acknowledge that I don't think there's disagreement on that point. Government has to play a role here. The question is what role and how expansive. And I agree with what was said earlier. I think he said that. Anyone who says, let's just keep government out of this, or let's just turn it all over to government, that there are very few people who believe either of those systems will work. This has got to be government playing a very strong role. But it really does boil down. I mean, I thought you framed up the question very effectively in terms of what is the guarantee that we expect from our citizenship? It is life, liberty, and the pursuit of happiness. But I think it's important to acknowledge that the phrase is pursuit of happiness. It's not the guarantee of happiness. It's not the Department of Happiness. It's not the Happiness Act. It is the pursuit of happiness. And it means that we all end up with an individual responsibility to pursue it with all and make our own decisions. That's part of life and liberty. Now, does that mean we are completely left on our own? No, it means we organize governments for the common good to help us deliver on those necessities. And that's why I agree this debate is so fundamental. And we're really debating what the role of government will be in our lives, not just in healthcare, but healthcare is such a personal thing that it's a wonderful forum for us to decide that question.
This question I feel is very powerful, and it's to the entire panel, is why haven't we tried options that don't cost the American taxpayer, namely tort reform and open interstate health insurance competition? Why are we attempting huge tax increases before the free options?
Well, I may be the best one to answer that. It's politics. Tort reform is protected by the trial bar on the basis of an argument that says the trial bar is the group that represents the small person, and they deserve their day in court, and they won't be able to afford a lawyer unless we have contingent fees and be able to go after them, and there's no way to do it otherwise. And it is very clearly driven by their defense of that principle. And there was a moment I thought we were going to see some tort reform at a national level when President Obama spoke about it in September. And I thought it would happen because they really needed the $54 billion it would save the government to have tort reform to pay for the care. But that has not occurred.
When they talk about tort reform, the initial pass-through is looking at malpractice premiums. And the malpractice premiums in some areas of the country are egregious. Some OBGYNs paying $2,000 a week in order to practice. But nationally, the malpractice premiums are not a large part of the medical bill. The tort reform problem comes not in the malpractice premium, but in defensive medicine. The number of tests that are done simply to defend yourself against a potential lawsuit. The legislature in Utah has just passed, just the other day, some significant tort reform. It makes a cap on non-economic damages, but more importantly, it puts teeth in what's called a pre-litigation panel. Malpractice claims need to go before a panel of citizens and physicians to decide if it has merit. If the panel says it does not have merit, then in order to go forward, they have to find another physician who's practicing in the state to say it has merit. And then if that case is then lost, then the loser pays court costs. And so it's put significant teeth into tort reform. And in states where that's been done, it's made a big difference in health care costs across the board because of the decrease in the need for defensive medicine. Yeah.
I'd like to say that the question could be rephrased a bit. Why hasn't anything been done? Why hasn't anything been tried? And the answer is the same one Governor Leavitt gave, because of politics. You know, I mean, we have a lot of vested interests everywhere across the spectrum in respect to every discipline, and a lot of people, you know, protect their territories, and, you know, there's no one single villain in this story. And that's why I say this is fundamentally a moral question we as a people need to face. And I disagree with the claim made earlier that we all want reform. The fact is there are many millions of people who simply don't want reform. You know, we can agree about the kind of reform we should best have and can achieve, but we're not yet at the place where we all agree we even need any at all of any kind. And you know, why haven't we done anything yet? Well, the answer is because of politics.
Right. I gave a lecture one time on healthcare reform to Dr. Miner's class, where my wife was. And one of the things I pointed out is there are multiple villains. As a matter of fact, just about everybody's a villain in this. You know, physicians, hospitals, insurance companies, pharmaceutical companies, governments, everyone has played a role in this because of watching after their own self-interest. But one of the things that's thrown out frequently is that 85% of the people are happy with their health insurance, and so most people don't want reform, like you say. But the reason for that is because they are protected from the economic realities of their health insurance. It's paid for by the employer. They don't realize that if the employer didn't have to pay that, they'd get a higher wage. There'd be more jobs available in that particular company. But because they're protected from the economic consequences of our system, they don't feel the pain to make that decision.
I would like to observe that the conversations we're having are about very complicated questions. That I raised the issues around a particular cancer in my remarks. That it costs almost $300,000 to treat a particular cancer in order to get 10 months of additional life. And I confessed I would sign up for that if I had the ability to do it. The problem is when you begin to turn over all of those decisions to government, the level of dispassion that's required to make good decisions does not exist. And it does not exist because of politics. It's because you've turned over to the wrong system decisions that people would make in different ways. And so we begin having a system where we're going to expect 535 people to make decisions that a lot of people would make differently if they could do it themselves. And it argues not for no government, it argues for a limited government. It argues for a government that establishes a construct in which people can then make decisions based on their own circumstances and their own interests. It argues for a system where the government does not guarantee happiness for every person, because that's impossible. It guarantees a system where people can pursue happiness and can have every opportunity to achieve it. But if we turn over anything to government that requires the kind of exacting value judgments beyond the big frameable discussions that a society has to make, like civil rights and the right to education and so forth, those are different than health care because those are entirely so personal in terms of the way they're carried out and the way the principles are exercised.
There was one point that I wanted to make about the very large health care bill that is before the House and Senate right now. And it is sad that it's gotten so large and it's become so egregious. But shame on any representative of our country who will not read that bill or who will not have staff members read that bill. For them to dig in their heels and say, I'm just going to vote no on this anyway. I'm just going to remain uninformed. This doesn't matter to me anyway because I like the way things are. I like the constituents that are keeping me in. Truly, shame on them. We do have to have a change. This time, if this goes through, it will be a very small change. It won't be enough, but it's a change. And my point is, it's going to have to be more to really take care of we the people.
Thank you. We have about 5 minutes left, and so the last question, I would hopefully have everybody spend about a minute expressing what their opinion of it is. This is one that applies to students as well as, and we'll start first with Governor Leavitt, if that's okay. When you spoke, and the question's addressed to you as well, is when you speak about this generation making changes necessary to solve these problems, what are some examples more that we as students can change next week, next month, next year, to make changes happen for healthcare reform?
Well, I would say that it starts with a realistic view of what you can expect government to do. Not to diminish the importance of government, not to be less involved in government, but to have a realistic view of what government can do to produce a prosperous nation. It's vital, but it is not the only ingredient. Second, I would say that we all ought to remember that 75% of the bill we're talking about is due to chronic disease. I'm talking about things like diabetes and hypertension, things that can be avoided with a better with better lifestyles. I'm talking about the way we eat. I'm talking about the way we exercise. I'm talking about the way we take care of ourselves. That, at the heart of it, is the problem. And this is a generation that's going to have to both become responsible for it and be willing to pay that price.
Dr. Minch?
I would say that everyone really needs to get involved in the political process in one way or another, and realize that you live in a country, like all people do, with limited resources. Not everything can be done, and we can only do so much, and we have to make hard choices. And if you believe that affordable and decent health care available to all people is a priority, then you're going to have to fight for it, and you're going to have to be willing to say what is it you're willing to sacrifice to have that. And we probably need to get some national priorities in order and figure out what's most important and what's less important, and spend our resources a little bit more wisely. And if all the other developed countries in the world can figure out a way to use the market and use government and some kind of partnership to deliver health care to all of its citizens, I don't know why we can't figure that out too. But there are very powerful, very rich interests who aren't interested in that happening, and so you'll have to take the fight to them to make sure that it happens.
I would just say, as a student, I log into Facebook. I don't know how many of you guys log into Facebook, but when I get on, I have a lot of friends that have posted talking points, and it could be from a Bill O'Reilly, a Keith Olbermann, but we kind of, in this generation, we have this tendency to latch on to these talking points, and we accept it as doctrine, and we accept it as fact. Because fundamentally all of us are very busy. We're full-time students, we're involved in extracurricular activities, we work, whatever the case may be. I think the biggest thing our generation needs to do is we need to understand the facts and stop taking all of these talking points at face value. We need to do our research, we need to do our due diligence in those matters, and then take that information, synthesize it, form it around whatever ideological or moral perspective we see the world through, and we need to do what Dr. Minch said, we need to act on it. This is an unbelievable country that has grown and prospered because of our ability as citizens to challenge the status quo and to get out and make a change. As students, we have a power and a propensity to do that very, very well. I don't know if any point in history it's been so important to a collective national student body as it is now to understand what we're walking into. Healthcare, one of the biggest catalysts for debt and a national debt, but there are so many other things that threaten to put a burden on our back. If we don't understand it, we can't change it.
End-of-life care is another one of these issues that I think Governor Leavitt is focusing on, and you don't know how bad it's going to be till you're there. My husband, Kirk, died of cancer, and I think that before I had felt like, well, when the end of life comes, then I'm not going to be one of these people that spend a lot of money to try to keep them here for another year, for another 3 months. I can tell you those last 3 months, there was money spent, and I am so grateful that I kept Kirk here for 3 more months. There are decisions that you really do need to be making and studying because you don't understand where they hit your heart or your family until you're right there with them. But they are very costly. I can't remember the percentage right now, but somewhere around 85% of our medical costs are with end-of-life care. The other comment that I'd like to make is let's all just keep a really good eye on Wall Street and the kind of things they're doing with derivatives, the kind of ways that they are gambling. It's kind of like the crystal meth on Wall Street right now. They're gambling with our funds across the whole world. AIG doing the most radically ridiculous things that I've ever seen. With us needing to bail out Wall Street, we need to make sure that these folks aren't causing us more problems. They need to be helping us do the good in getting jobs for people, doing good in getting health care for people, not out there speculatively gambling. And now even Goldman Sachs is very connected to Greeks' downfall, that they were doing derivative trading with them and betting against Greece. So even though it's not directly related to health care, I'd say please read your business pages and keep an eye on the businesses that might not be acting the way they should.
I already have two comments. The first is to reiterate Governor Leavitt's that the need for personal responsibility. The computer turned off, but I have this great slide that shows over the past 15 years the obesity rate in the United States, and it's unbelievable. And that's going to lead to diabetes and more problems. There's smoking, exercise, diet, all these things that aren't in control. We need to have personal responsibility for that and personal responsibility for however we elect to access the healthcare system. But the other thing that talks more to his initial point in his keynote speech, my father's generation was the World War II generation. It was the greatest generation, according to Tom Brokaw. Some people have decided that my generation is going to be described in the future as the most selfish generation. When I was in college, we were demonstrating against Vietnam all the time. I don't understand why the college students of today are not demonstrating against the financial burden that my generation is placing on your backs. And I think you need to be responsible for bringing that to light and pressuring our generation to not leave you with this. I will be gone when you have to pay it back.
On behalf of UVU USA and the Academic Senate, we'd like to thank everybody that came and hope you enjoyed it, as well as let's give another round of applause for our wonderful panelists and especially Governor Leavitt for coming to speak to us today.